Well, thank you so much for having me, and good morning, afternoon, and evening to everyone, depending on where you're tuning in from. And thank you also so much for the invitation to join you today to talk about flourishing futures and to explore really meaningful cross-sector and collaborative approaches, which recognize that the health of individuals, societies, and our world are all interconnected. I want to thank you, especially Dr. Susan Prescott and the NOVA Network for inviting me to talk today a little bit about the ways that places and spaces can support inclusivity, health, and yes, in fact, flourishing. I'm just delighted to be here with you all. So as a brief introduction, and yes, there's a little bit of a bio on the website, as Susan mentioned, but my name is Giselle Sebag, trained in sustainable architecture, public health practice, and urban planning. So a little bit different than some of the typical backgrounds that we see coming into this space. And I'm really focused on working to improve urban health by design. As Dr. Prescott mentioned, I have the pleasure of serving as the executive director of the International Society for Urban Health. And for the past 20 years, the International Society for Urban Health has been the only global non-governmental organization dedicated to advancing our mission to work across all of the disciplines and sectors to address the urban determinants of health and health equity to attain a healthier future for all people in all communities worldwide. And the ISUH is especially interested in the ways that we can translate the vast amounts of evidence that has been gathered over the last 2 decades, looking at the ways to build healthier neighborhoods, communities, and cities, translating that into action and into impact for residents on the ground, regardless of their geography, of their background, of their age, or of their income. So the work that you all are doing by participating and attending in the NOVA Institute's annual conference on flourishing futures is really, it's all about this critically important and life-saving work. And that's work that many of you may already be contributing to without necessarily realizing it. Because the thing is that whether you all recognize it or not, all of us play an important role in shaping health, whether that's through our dedicated time in our profession or getting engaged in local community development issues, or even voting for your local policymakers, or spending time in your neighborhoods with your friends or with your kids and more. We can either find opportunities to promote improved mental, physical, and social health in our environments, or sometimes hurt it and perpetuate the existing systemic health inequalities that we have. So yes, this is actually a really big responsibility that we all have, but it is in fact a choice. And I hope that part of what you take away from this talk and from this great event, this great conference that Dr. Prescott has organized, is that we all, we have an ability to recognize the roles that we play in shaping health and to enable flourishing, and hopefully choose to consider and use that power for good today and in the future. So a brief intro to why planning places and spaces for health really matters. Just want to remind ourselves of the ways that our environments, the many ways that our environments impact our health. So there are a multitude of ways that our social and physical environments make an impact on our health and well-being. And I'd like you all to kind of think about, or I like to think about these determinants in 3 main buckets. So your genetics, and those are things that you're born with and we can't really change very much. Your environment, so that's all the things from your natural, your built, but also your social environment, and your behavior. So choices that we make about diet, exercise, smoking, or drinking alcohol, for example. But there's good news here. And the good news is that scientists now know that the leading drivers of death and disability globally, of things like heart disease and cancer and hypertension or diabetes, those are determined almost entirely by your environment and your behavior. And your environment and your behavior are changeable. So here you can see that WHO has linked 23% directly to changeable factors in your environment, but many like me think that the actual impact is closer to 75 or 80% when you add up all the indirect ways that our environments change social and economic health determinants. So in fact, your behavior is highly influenced by your environment. Just as an example, I mean, you really can't choose to walk if you don't have a sidewalk, can you? So each of us in different ways, we really do have a tremendous amount of influence over how our natural environments impact our mental health, our built environments can help or hurt our well-being, and how to facilitate social connections and activities that we know impact mental and social health. People like in professions like urban planners or transportation engineers or developers, urban designers, city governments, even residents, among many others. They have a tremendous power. We all do, to create environments that make the healthy choice the easier choice. For example, by designing safe walking or cycling paths into your projects, into your neighborhoods, so that people have the choice to safely engage in physical activity, things like active transportation, or as Mark talked about, having access to nature, or not being exposed to gun violence, or having ways to engage in physical activity outside. Those are all important ways to positively influence mental health in children and their caregivers, or even, adults in any community. So let's look at some of those examples. And just to also say, this is to illustrate the neighborhood environments, the way that they make an impact on our health by looking at some life expectancy differences within the same city. So in many, many cities, the number one predictor, more than anything else, of how long you're going to live is where you live. So here's an example of New York City. Maybe it's a bit small to see, but here you can actually see that there are dramatic differences of up to 20 or 30 years of life based on neighborhood. So what that means, many of you are very well aware of this, but I still find it crazy to consider babies that are born right down the street from each other. They might expect to live 65 years or 95 years based on whether the places that they spend time support and promote or inhibit the health of the residents. So very critically, the decisions that make the greatest impact on health are almost entirely made from non-health actors. So people who are not considering or calculating the health effects of their design, development, or planning decisions, or even of the policymakers that are making decisions on their behalf in the neighborhood. So that in effect makes anyone working to change the physical or social environment that they spend time in a health worker. And what are some of those building healthy places design principles and benefits? There's especially important work impacting 5 critical aspects to designing healthier cities around air pollution, noise, physical activity, natural spaces, and temperature. But there are countless ways that the design of our communities impact our health by determining, for example, if there's clean air, access to clean air, or healthy or affordable food. What is the risk of you walking down the street and getting hit by a car when you're walking to school or to work? Is there a quiet place that you can go to sit in nature, to recharge? And how does that impact your mental health? Is there a place to sit and cool off on a hot day in the shade? Or is there a safe place to exercise or to play, or to sit and to talk to your neighbors? If you go outside, are you going to experience some sort of gun violence or many other areas? So for example, you can design to promote walking or biking, what we call active transportation, and to really build physical activity into your daily routine, like many people do in New York City if they don't have a car. The US Surgeon General put out a call a couple of years ago to planners to do just that, because building in just a bit of walking into your day is one of the best ways that we can prevent some of the leading causes of death and disability, things like cancer, hypertension, or diabetes. And you probably know that insufficient physical activity or sedentary behavior is one of the largest killers that we have worldwide. You've probably heard things about sitting being the new smoking, and there are countless studies and a huge body of evidence that do show us that physical activity is one of the best ways to prevent chronic diseases and conditions, and to also strengthen the immune system. And I'm sure many of you noticed during the lockdowns that you experienced in your countries, but a lack of physical activity for many of us was a really big challenge that caused poor health outcomes and also impacted sleep and really affected mental health as well. So one example of how poor community design can affect children's daily physical activity is thinking about walking to and from school. In the US, our Centers for Disease Control and Prevention did a study looking at or finding that the distance and traffic danger were the main reasons that parents didn't let their children walk to school. But when new schools are built, often in the US, a long distance away from families live, then children are driven to school, which really deprives them of an opportunity for physical activity, but also for socializing with other students and contributing to air pollution or a risk for automobile crashes. Whereas on the other hand, if safe routes to school are provided, or if schools are located within an easy walking or biking distance to where people live, then children can make walking and biking part of their daily lives. And that can establish healthy habits that really do last an entire lifetime. So on that same note, communities that make it easier and safer to walk, bike, or take public transit can reduce the number of cars on the road. And the combination of fewer cars on the road and how cars, bicycles, and pedestrians share space are all critically important to reducing traffic-related deaths and injuries around the world. More than 1 million people still die every single year from car crashes, and it is one of the leading causes of non-disease related deaths for all ages, and the leading cause of death among those ages 5 to 29 globally, which is pretty mind-blowing. Sorry, I'm just going to actually go back to one more point on this, which is that the main idea that I wanted to bring up with this slide was around the fact that traffic-related deaths are actually preventable by design, almost entirely. And in fact, Emily Badger, if some of you know her, she just put out an article this week in the New York Times talking about how poorly the US ranks in car accidents related deaths compared to the rest of the high income countries globally. And the ways that really sadly, this reflects a political choice that the US has made to not prioritize preventable deaths through infrastructure redesign of our roadways, whereas other nations have, and in turn, they've been able to drastically reduce pedestrian and cyclist deaths. So just to bring a light to the point that we can change those outcomes if we so choose. Communities where healthy foods are not accessible and affordable contribute to obesity epidemics all over the world. A healthy diet can be very difficult for some to actually have because healthy food options are often not readily available or accessible or even affordable in their community. So sometimes they're available, but nobody can afford them. There's a lot of studies that have found that low income and underserved communities often have limited access to stores that sell healthy food, especially high quality fruits and vegetables. And good nutrition, of course, is vital to good health and to disease prevention. But it's really hard for people to eat their fruits and vegetables or to stay away from too much junk food and change your behavior, if you will, if they don't have access to those fruits and vegetables in the first place. So this has been talked about, and I won't go into too much because I know that you all are aware of this, but there are so many massive health benefits of spending time in nature. And the evidence is really, really clear that it is one of the most effective medicines that we have for decreasing stress and anxiety and mood disorders, with important positive effects on cognitive development, attention capacity and learning, both in adults, but also in kids. And the benefits for kids are even greater, starting with air pollution and nature exposures that pregnant mothers do get. So this seems really obvious, but the research does show that places with less inequality have healthier citizens. And so this idea of a fabric of a community and a community pool of human resources is often called social capital, referring to individual and communal time and energy available for things like community improvement or social networking and civic engagement, personal recreation, and other activities that create social bonds between individuals and groups. And those activities and bonds can have a really profound effect on mental and physical health. I feel like often that's something that's kind of overlooked or seen as not very important, but the research is clear that that makes a big difference. And neighborhoods that have those places to spend time and to have, an opportunity for social capital, sometimes called third spaces, as in not work and not home, but somewhere else to gather together and to spend time socially. Places like in a park or a coffee shop or at the barber have more of that available. And then, of course, many of us are experiencing this today, and it's getting worse and worse. But finding a good home in a safe neighborhood that's convenient to your jobs, to good schools and other daily needs can be difficult. And usually the neighborhoods with lots of amenities close by are more expensive because more people want to live there. But the people who work in these neighborhoods and can't afford to live there, they often have to live in faraway places that might be less safe and certainly take more time, which increases your stress to get there, to commute there, and could be more dangerous if you have to ride in a car, for example. So healthy community design principles support social equity by promoting the communities where people of all abilities and all ages can move around in their communities to meet all of their needs, and should they choose, remain in that community for all of their lives. So that's also thinking about the changes that can happen with gentrification, for example. So just to review some of the ways that healthy community design can improve our health where we live, work, play, and grow. Many of these principles that make communities healthier also make them more attractive and more affordable places too. And when we improve one aspect of health through design, we impact many, many others. So creating safe and comfortable streets and sidewalks that encourage community members to incorporate physical activity into their daily routine by biking and walking, or increasing access to healthier foods, or providing transportation options like public transit, biking, walking that can reduce traffic and also air pollution, or protecting water quality and making communities more attractive by preserving wetlands and undeveloped land. This valued land can also give people a place to play and relax and connect with nature, which is all good for social and mental health. And I just wanted to sort of mention, after this conference ends at the end of the day, I'm hoping that we'll all start to consider the ways that better health, equity, and social connectedness can be influenced so much by the places that we all spend time, that we live, work, and play. And all of these aspects of place are sort of interconnected and have co-benefits for one another. In our work at ISUH on a new project that we've started, the Accelerating City Equity Project, we've really begun to uncover some of the key drivers of equity in place-based projects. And we recognize that using place as an entry point and letting the community lead the development process, which are core elements of this idea of placemaking process, can start to drive greater equity through our work. And so I just wanted to take a moment to ask ourselves, whether it's through your work or your community or your civic engagement in your neighborhood, what is it that you can do to encourage and sustain better social connectedness in your community? And in that thinking, are you thinking about the ways that the health impacts of design and development decisions being made in your community, do they actually offer benefits to, some of the more vulnerable members of the community, like young children or their caregivers or seniors? And our local initiatives that are happening, making the healthy choice the easy choice for all community members, regardless of their age or their income or their ability or their cultural background. And maybe there's something you can think about today regarding what you could commit to do to improve health in your community and to promote holistically flourishing futures for all of us. So thank you so much for your time today, and would love to stay in touch, and please feel free to contact me.